Hi, this is Dr. Malara. Just wanted to take an opportunity to talk to you a little bit about macular degeneration today. I imagine somewhere, somehow, it's come across, the conversation has happened, someone in the family, someone you know, over time has come up with concerns about or has developed macular degeneration. It is an age-related condition, so it's not something we typically see in young people. When it does, it's a different condition that mimics macular degeneration, but macular degeneration as a whole is more of an elderly population concern. And over time, it's much like exposing yourself to the sun and getting sunburned over and over again, and that sunburn damages the skin and it leaves you more at risk for things like melanoma. But in this case, that sun is damaging the inside of your eyes, and these little free radicals that bounce around are causing damage. In the picture here, the body responds by forming these little drusen, and these drusen are these yellow bits of debris that actually get into the retina and cause damage. The central part of the retina we call the macula right here. These drusen are all around, but I'll show you a picture in a moment where they're actually underneath the retina in the center part of the picture. And so this is what it looks like when it's more advanced. There are lots of other times where it's not so advanced, but the condition itself, maybe again, there's a family history, because genetics plays an important part in all of this. And so we have a screening device that we use called the AdaptDX that helps us to quantify what your risk level is. It can actually detect macular degeneration up to 3 years before it actually is perceivable in a picture. So it's pretty remarkable technology. We brought that on because we feel like we know that it's important to catch things before they become a problem. And so in those early stages, the things we recommend are more vitamin supplements. Supplements that we use, I Promise, very high quality vitamin. For people that have no signs of any macular degeneration in their eyes, it's very important to get lutein and zeaxanthin in there to help stabilize the retina and protect it. So this on a daily basis is a pretty easy thing and pretty inexpensive thing to use. When we're getting closer to the point where we're beginning to see early changes, Restore is the formula that has other things in it other than lutein and zeaxanthin, but those are two of the primary ones. For people who are older and who have active signs of disease, we recommend an AREDS 2 formula. This one is zinc-free if you're concerned about zinc, or are a smoker, because then zinc is not recommended along with beta-carotenes. But the AREDS stands for Age-Related Eye Disease Study, and there were 4 of those done. This is the one that continues to be the formula that is best for all folks who have active macular degeneration. So just real quick, I want to just go over some of what we're talking about here. So this is what it looks like more advanced. And so if we were to take a slice through the retina, we have an instrument in our practice called an OCT. It's an ocular coherence tomographer, and it actually takes a slice through the retina in the most critical area. So this whole picture is the macula, but the direct center where there's a little dip is called the fovea. That's the direct center, the most keyed in part of our vision where all the detail focuses. And you can notice on the bottom layer all these little jaggedy up little bumps. Those bumps are those little dots that you just saw in the previous picture. So when we go back to that picture, you see all these bumps, and right in here there's bumps as well. You just can't see them as well, but when we take a scan, you're going to actually see those bumps underneath the retina pushing forward, and when they push forward too far, it breaks through the retina and it causes damage that cannot be reversed. A picture where it actually causes edema to happen. This is actually swelling in that area. You no longer see the dip, and now it's actually pushed that dip up, and now it's a hill. This is not so good. This is where we would refer you to a retinal specialist, and they would probably do advanced forms of treatment like injectable medicines or laser to fix that. So lastly, I'm just going to cover a few more things. This is just a practical idea of what happens in macular degeneration. What normally would be clear through the entire picture begins to take out the center portion of the picture. So macular degeneration affects the center of the vision, whereas the periphery remains intact. but because the center is responsible for detail and color vision, that's what happens. We lose all the detail when we look right at something. When people begin to experience this, or we begin to see signs, we'll do all these tests and we'll recommend vitamin therapy. So when a person is beginning to, we see signs that a person is beginning to have some of these changes in the macular part of the retina, we give them this little grid to take home. They can print this out from our website, or they can have an in-house copy. But the idea is to stare at the dot in the center, one eye at a time, with a reading correction on if they have one, and determine whether or not with their side vision any of these lines appear wavy, distorted, or missing. And so any distortion means that there's changes happening in the macular area that we need to immediately address. And so when someone gets this, they take it home, they cover an eye, and they see that things are wavy and distorted and all kind of warped and disfigured, then we know that there's an immediate concern that we need to address. And so that patient would come in, we would assess them, do the testing that we talked about, and then if needed, we would send them to the retinal specialist to have them treated. If they do not have any transition from what we call dry macular degeneration, where we use vitamin therapy and monitoring, versus wet, where there's actually leakage of fluid underneath the retina, that means we need to send them to a specialist for special types of treatment and medical intervention that oftentimes starts with an injectable medicine to stabilize the retina. So there's a lot to know about macular degeneration, and I know it's impossible to fit it all in a short moment. That's why we want to point you towards our website, where you can investigate that a little bit more. And obviously, if there's ever any questions, you can always feel free to call the office, and we would be glad to talk with you through it as well. The important thing is to remember that everything that's happening now, wearing sunglasses that are UV protective, taking a simple vitamin like lutein and zeaxanthin, even when you don't have the disease, you need to do everything you can to protect your eyes from the future. We see this when folks are older. So everything now is just as important to keeping that from happening later. So again, thanks for listening. Dr. Malara, we appreciate you taking the time to view this video.